Hi everyone, I'm Erin Anderson and I'm the Director of Programs and Advancement for the Autoimmune Hepatitis Association. I'm here today with Kelly Kinkade, who recently received a living donor transplant from her cousin. She's generously agreed to sit down with us and share her story in hopes of helping other patients with autoimmune hepatitis. Kelly, welcome.
Thank you for having me.
Thank you for being here. We really appreciate it. You received a liver transplant at IU Health in July. How are you feeling today?
Today I'm feeling great. It's a beautiful day here in Indiana. So this morning I actually went on a 30-minute bike ride, and it's been a life changer, that's for sure. But I am feeling almost 100% now.
Great. Can you tell us a little bit about when and how you came to be diagnosed with autoimmune hepatitis?
Yeah, it was approximately 8 years ago. I started to get really ill. Now, at the time, I had recently graduated from law school. I had started my own practice. I was also still very active. I would get up at 5 and go to the gym. So I originally thought that I was doing too much. I was really tired. Not only that, but I was having problems eating. Everything I ate made me nauseous. So I figured I just needed to, take it a little easier than I had been. Then I turned a bright yellow, which was very concerning, especially my eyes. My eye whites were yellow. So I went to my doctor. At first, they said they thought it was gallbladder issues. I went and saw a surgeon who said it wasn't my gallbladder. So then they thought maybe hepatitis A. They were running a series of tests, still could not figure out what was wrong with me, just that my liver numbers were pretty bad, my liver enzyme numbers. And overnight, I put on about 30 pounds in fluid. And I was having problems breathing. So I went to the emergency room where they ran a series of tests, did a liver biopsy, and finally, it was there that I was told that I had autoimmune hepatitis.
And can you tell us a little bit about the treatment you've been on since you were diagnosed with AIH?
Right. So they started me on prednisone, which is obviously a very important drug, but one that has some unfortunate side effects. I also have type 1 diabetes, so it sent my blood sugars through the roof. So I was put on prednisone and then the steroid budesonide, and then now I'm back on prednisone. I was put on Imuran to start with and then changed to mycophenolate, which is an immunosuppressant. So those were the first two things that they did. They put me on diuretics for the fluid retention. I started to have about, I would say, 2 years into my diagnosis, some symptoms of hepatic encephalopathy. So I was having problems with cognition, problems with my sleep cycle reversed, so I was up all night and I was asleep all day. I was having memory loss. So at that point, I actually had a series of stents put in to try to force my blood back through my liver to cleanse it better, to take out some of the toxins and some of the ammonia that was causing the encephalopathy. And I had that procedure done 3 times. I had a series of procedures done to fix varices in my esophagus. So I would have the normal endoscopy every 3 to 6 months. I would have banding about every 6 months for those varices. I, at one point, developed a bleed in my stomach that required treatment. So I would always joke that about every 6 months I would end up being admitted to the hospital, and I refer to it as just getting my tune-up. So I had a series of procedures as well as medication to try to control my disease and my symptoms.
you've had a rough go of it, and most AIH patients don't have these severe symptoms that you do, and most don't ever need a transplant. But I understand that you knew quite early on in your diagnosis that you would eventually need a transplant. What was receiving that news like, and what did you do to cope and learn as much as you could about the disease?
Right. So this would have been back in probably 2012 that I would have gotten my diagnosis. Literally, while I was in the hospital, within the same breath that I got my diagnosis, I was told that it wouldn't be today, it probably wouldn't be next month, but at some point in my life, I was going to need a liver transplant. It could be 5 years, 10 years, 20 years, they didn't know, but that I had already developed cirrhosis. And I had never heard of autoimmune hepatitis. I, prior to this, was very active. You know, I was going to the gym, I was watching my diet. So I really didn't think that somebody like me would get sick. So it was shocking, that's for sure. I'm a very stoic person. I don't cry a lot. I'm not overly emotional, but I did get teary-eyed when I was told that because it was so shocking. And at the time, there really wasn't a whole lot of information out there about autoimmune hepatitis. So of course I did my Google searching, and really the only thing that I could find out was they don't know why people get it. They didn't, most of the time it was women in their late 20s, which described me perfectly, who were mostly otherwise healthy, and that some people needed a liver transplant, some didn't. It depended upon the progression of the disease. And so getting information was very difficult at that time. So I'm very happy that this organization is actually out there to educate people and to provide some resources that were definitely not there when I was diagnosed. But I tried to find out as much as I could, about the hospitals that were treating this disease, to see if I had options in terms of treatment. And I found out as much as I could, mostly about liver transplant, because I knew that that was in my future, one way or another.
And can you tell us a little bit about what led you to pursue a living donor transplant?
Right. So, you know, they decide where you fall on the transplant list by a number of factors, but one of the most important is what's called your MELD score. And my MELD score was consistently low, consistently somewhere between 10 and 15, which is very low. And I was told by a doctor that it was going to be very difficult for me to get my MELD score up to a place where I would likely receive a liver from a cadaver. So very early on, I'm very proactive. So very early on, I started researching, okay, what are my other options then? And my other option really seemed to be living donor. And at the time, I live in Indianapolis. At the time, Indiana University Hospital, which is the transplant really place here in Indiana, was not offering living donors. So I first sought treatment at Northwestern through their living donor program. Unfortunately, we tested, I think, 10 to 11 people, and none of them turned out to be a good candidate. So I then went to the Mayo Clinic in Rochester, Minnesota, and it was there that I had this series of stents and coils put in. But they did not think that I was sick enough. While I was very sick, I wasn't sick enough for them to pursue living donor with me. And I came back and started going to IU. And at the time that IU was actually looking into doing living donations, I was looking into going to UPMC in Pennsylvania. And it was actually at the doctor's appointment that I was planning on discussing the possibility of going to UPMC that my doctor told me, can you give me 6 months? Can you hang around for 6 months? We are starting a new program. And being from Indianapolis, I really wanted to stay here. I just didn't think it was going to be a viable option. And finding out that it was going to be an option was very exciting, gave me a lot of hope. So I told him, absolutely, I'll stick around. And it was about a year after we had that conversation that I received my new liver from my cousin.
How did you learn that your cousin was a match for you?
So I have 2 brothers, one of whom was not, we just knew was not going to be a match. My other brother was deployed. He is a major in the Marines and was in the Pacific at the time. So I started reaching out to other family members, particularly on my mom's side. She is the oldest of several children. So I had several cousins on that side. And one of them, who I was not particularly close with, his name's Paul. He is about 10 years younger than me. So growing up, we weren't very close. He just really felt called to do this. He felt like he was in a good position to do this. He really wanted to pursue this. And after I sent him some resources and he learned more about it, he still wanted to go forward with it. So I obviously was not going to stop him. He's very shy, though, very introverted. So we didn't really talk a whole lot about it. He just wanted to go in and get tested. So I went through a series of tests, making sure that I was healthy enough for the surgery. Luckily, at the time, I was still fairly active. I was sleeping probably close to 20 hours a day, but I was still able to get up and care for myself. And I was doing yoga still and things of that nature. So getting through the testing was pretty easy for me. I had to undergo heart and lung testing. I had to have a heart cath, and another endoscopy, but all of the testing was pretty mild compared to what I had already gone through. He went through the testing. He's young, he's 24, so he has no health issues at all. So he went through the testing, and then he was almost finished with the testing when COVID hit. So they put the program on pause. And then once our state had decided that they were going to go ahead with elective surgeries again, then he started the testing process again. And I had been in contact with a coordinator who had told me around mid-June that they were looking at a date in July, possibly July 20th or 27th. And it was actually July 13th when I got the call from the surgeon telling me that they had everything scheduled for the 20th, so would that work for me? And obviously I said yes. So it was very surreal. We were actually the first ones in, I think, 20 plus years to go through a living donor liver transplant at the facility. So it was very surreal. You get to the hospital. They already had him in surgery because he has to go in first. And I was just waiting, and they rolled me in, and then the next thing I know, I'm waking up in the ICU with a new liver. So it seemed like a very quick process, quite frankly, from the time that it started. And they got us in, and we both are doing fantastic now.
What was that week like in between learning that you were going to receive your living donor transplant and then actually going in to have the surgery?
Slow. I had been really seeking out a living donor transplant for years at this point. I had gone to, this was the third program that I was involved in. So I was very educated at this point about what everything would be like. And so it seemed to go very, very slow. And the night before, I got very little sleep. Um, I was not nervous. I was never nervous about this, even knowing that we were going to be, if not the first, one of the very first people. My feeling always was that one way or another, I was going to get a new body. I had a lot of confidence in my surgeons. I knew that they were well trained, that they were some of the best, if not in the country, in the world. And I knew they knew what they were doing. But I also knew that there were risks. And I knew that either I was going to get this liver from my cousin and get my new body, or if I did not make it through the surgery, I knew I was going to go to heaven and get my new body there. So I was never really nervous. It was more anxious to get it done. So the week seemed to creep by the night before. I couldn't sleep, mostly out of excitement. And then when I got to the hospital, seconds seemed like minutes. And when they finally did roll me in, and I was very excited, and it all went very, very quickly from there. But the week before was full of just trying to get the hours to pass quicker, that's for sure.
And how did you feel when you woke up from the surgery?
Besides feeling the pain, I remember thinking that I could not believe this was real. I even kind of touched my stomach to make sure there was an incision. Even though I could feel it, I just wanted to make sure, because so many times I had been told, sorry, you have to wait longer. Sorry, this isn't going to work out. Sorry, we can't do this. Sorry, we can't do that. That when it finally did happen, it was almost hard to believe that I had finally made it, that I was finally going to feel better, that I wasn't going to feel that fatigue, that I wasn't going to feel that nausea, that I was going to be able to make memories and remember things and get back to work and everything that I was excited to do. So while it was quite painful, at the time I was on a very high dose of steroids, and steroids give me incredible back pain. So not only had I gone through this very long surgery where I was on my back, but I was on a lot of steroids. So really the back pain, my muscle aches and pains were the worst. But I was just excited to get going and to get started. I had no problem getting up out of my bed when I woke up. I think a lot of that is a credit to the fact that I was still active. I didn't have to wait until I was on death's door. I didn't have to wait until I was really sick or in a coma or anything like that before I had this transplant. So I was able, I think it was maybe 2 days, 3 days, I was walking around the floor doing laps on the floor. So it was excitement. It was very surreal. I could not believe it had actually happened. Like I said, I checked to make sure there was an incision because so many times I had been told, no, sorry, that when it finally did happen, I was so excited to get back to life. And at times I had to rein myself in and remind myself, okay, you are still recovering from a major surgery. But it was just excitement and a feeling of hopefulness for the future.
So now you're about 2 months post-surgery. Are you back to doing some of the things you were able to do before you were diagnosed with AIH, but hadn't been in recent years?
Absolutely. I would often tell people that after that length of time, I had forgotten what it felt like to be well. And the energy level was what really surprised me. I could not remember the last time that I could get through a day without having to take a nap or having to take a break, or even it being more normal for me to be in bed than out of bed. So I was able to go and do things without having to worry about, okay, how long is this going to be? Am I tired? Am I going to be able to make it through this? I was able to say yes to plans without wondering, okay, or having to tell people really, all right, I'm going to say yes now, but I don't know what I'm going to feel like when I wake up that day. And so just being able to, last Saturday, I went to the zoo, which isn't really a big deal to most people. But to me, it was, because I didn't have to worry about, all right, what time are we getting there? What time am I going to have to wake up? Am I going to have a lot of energy? Am I going to even be able to make it through it without having to say, you know what, I'm sorry, I got to go. I had none of those thoughts and none of those fears. And I went, and never once did I do like a mental check. All right, how are you feeling? Are you going to be able to keep going? Are you starting to feel tired? Do you maybe need to take a break? So it's really just the little things that I think a lot of people take for granted. But when you get used to having an illness for so long, you get used to doing certain things and structuring your life in a certain way, and not having to have those worries or those doubts about getting through the day. That really, that's been the biggest difference between myself now versus myself prior to the surgery.
That's so great to hear. We're really glad that you're getting your life back and doing some of the things you enjoyed before diagnosis. How is your cousin doing?
He's doing fantastic. The biggest issue, he actually was only in the hospital, I think, for 5 days. The biggest issue he had was that he didn't like the pain medication, made him sick to his stomach. So he really didn't want to take any of the pain medication. And obviously the hospital, they had no issue with that. So the biggest issue he had post-surgery was that the pain medication made him feel sick. And so they gave him Tylenol instead. And then he was fantastic. I think it was maybe the next day after surgery, he walked into my hospital room. No big deal. So he's doing really well. He's back to work. His favorite thing to do is fish. He's back to fishing. So he's doing better actually than they expected him to do. His liver has actually regenerated almost 100%, and they thought that it would take probably another 30 days or so for it to get to that point. So he's doing better than they even expected. So I joke that thankfully he's still happy he did it. And he actually told me the other day that he sees his scar as a badge of honor, that he did this for somebody else, and it is a great source of pride for him now. So I'm happy that he came out of it, with this sense of pride, and that he's doing as well as better actually than expectations. So obviously his well-being was one of my biggest concerns. I was sick before, so for me it was any little bit of wellness was going to be a great improvement. For him, though, he was completely healthy and willing to do this. So I was very worried about his well-being. So I suppose that when the biggest issue you have is that the pain medication makes you sick and you don't want to take it anymore, that speaks volumes to not only who he is and what he did and his outlook on things, but also to the surgical team who did such a fantastic job on their we were the first patients to go through with this. So it speaks volumes to the surgical team at IU and what they were able to do as well.
What advice do you have for other autoimmune hepatitis patients facing liver transplants?
Don't ever stop being your own advocate. Push forward as hard as you can. Prior to all this, I was very much the type of person who felt like I could take care of myself and I didn't need help from others. And I didn't want to bother the doctors with things that I had going on. And during this, I learned you have to be your own advocate because nobody else is going to do it for you. And not only was I my own advocate, but I enlisted, and he sort of enlisted himself as well, my father to act on my behalf and to be another advocate for me. When I was really sick and just didn't feel like dealing with doctors or appointments or anything like that, he was there as my backup. Obviously, I'm his daughter. He does love me, and he wants to see me get better. So he was invested in this as well. And he was actually, if things didn't work out with my cousin, he was going to go forward with the testing and try to be my donor. So I had not only myself, but I enlisted somebody who loved me and was also invested in my healthcare to also act as my advocate when there were those days where I just really didn't feel like dealing with it, or where I was too tired, or I felt too sick, or I really didn't want to go to that appointment. Somebody else in my corner. Also, though, my faith and my trust in God was so helpful to me. It kept me hopeful for the future, because when I would receive that bad news, or when something wouldn't go as I wanted, I reminded myself that there was something bigger than me going on here, something that I might never understand while I'm on this earth, but there was something other than myself at play here. So having that faith really grounded me and really helped me to get through those times where you want to give up. You want to just say, you know what, I'm done with this. I'm not going to get out of bed. I'm not going to, maybe comply with the treatments. I don't want to do these treatments. I don't want to do this anymore. It really helped me in those times to have my faith, and not only my faith, but my family, who I always kept informed so that they could be cheerleaders as well. Tell people who you love and trust how you're feeling. I found that people didn't see it as a burden for me to tell them what was going on, but rather they wanted to know. They wanted to know how I was doing. They wanted the authentic, true, real me. They didn't want I'll just put on a smile and pretend like I'm feeling okay today, even though I'm not. So surround yourself with those people who love you and allow them to be a part of your journey. So I would really encourage people to be their own advocate, but find others to advocate on their behalf, and to share with their loved ones what is going on and how they really are feeling. Because you don't have to carry this by yourself. And if you do try to carry it by yourself, it will overwhelm you. So having that support and my faith, God never once failed me, was critical during that time period. And I don't know where I would be today if I did not have that.
At what point in the process do you think AIH patients facing liver transplants should consider living donor transplants?
So for me, it wasn't going anywhere. And I wasn't getting better. I was getting progressively worse. and I was facing a future where I would continue to get progressively worse. So really, before you get to that point where you're on death's door, I would encourage people to ask their doctors about it, talk to them about it. If you're at the point where you're too sick but not sick enough, which is a weird way to put it, you're too sick to really be enjoying life, but you're not sick enough maybe that getting a liver from a deceased donor is viable. So, and if you have people around you who, you can talk to and see if they're willing and what their feelings are about it, about perhaps being your donor, that makes a huge difference. I had several family members who wanted to get tested if it came to that. And obviously my cousin was a very strong advocate for himself to be my donor. So if it feels like everything's kind of coming together and you talk to your doctor and they feel, maybe that is a good way to go, then I would really encourage people to look down that path. Because again, I always felt like because I was still relatively healthy going in, it made my recovery so much easier. And I also kind of had another person to go through with it. My cousin and I recently got together and we were talking about our experiences in the hospital and, things like that. So if you're too sick but not sick enough and things are going nowhere, and you have that support, I would really encourage people to look into it.
That's great advice. Is there anything else you'd like to say or add?
I would just reiterate that, at times this can feel very lonely, but I think if most people reach out, there are now support groups. I know there are now some resources. If people look and if they reach out, they will find that they are not alone in this. This is a very, it's a disease that at times I think can leave you feeling lonely and helpless, but you're not. There are people out there who want to help you. There are resources out there for you. So I would encourage people, look for those things. Look for the people who want to support you. Look for the resources that are there to help you through those days where you just don't know how you're going to get through it. So I would really encourage people, again, in a sense, to be their own advocate in that way as well. And to not only focus on your physical health, but your mental health as well. And do everything that you can to stay as healthy as possible and just keep fighting. Because in the end, you will come out a stronger, better person for it.
Kelly, thank you so much for being with us today and sharing your story. We wish you the best in your continued recovery.
Thank you.
Thank you.